Hello, Protrusive. I'm Jazz Galati, and welcome back to the Protrusive Dental Podcast. This is an interference cast, which is a non-clinical interruption. For those who are listening, I don't know if I sound different. For those who are watching, you'll notice this crack on the ceiling, and my room looks very different. And where's my background gone? I'm recording in my sister's old bedroom in my parents' place because Hardeep, our guest today, who is just a fantastic person. She's a shining light in dentistry. She's blossoming into this amazing voice for females in dentistry. And I brought her on to talk about Parenthood in Dentistry. It was so difficult to plan this date that it actually worked out that I'm recording not in my usual studio. So do excuse the acoustics and the video if it's a bit different. For those of you that know me, parenthood is something that's really important to me in my life. And I'm so happy to be sharing this episode with you guys. Even if you're not a parent, and you never want to be a parent, I think there's so much you can gain about our discussions in work-life balance. Like Hardeep made me change my thinking about it not being balance, it's about work-life quality. So we discussed that towards the end. We talk about family planning and how, especially for females and mothers to be, this could really change your career trajectory. And we kind of touched a little bit on why perhaps in dentistry, women in dentistry sometimes do not get the spotlight they truly deserve, especially when you look at the lecture circuit. There are many more male dentists on the lecture circuit, despite there being more females in dentistry up and coming than males. So motherhood may have something to do with that. The challenges, the unique challenges, like being mum is the most difficult job ever. I remember Lakshmi Kanagati, I know you're listening to this. You're one of the loyal Protrusive, and you came to our live sprint course day, and we just talked about being mum and being a practice owner and how it poses such unique challenges. Now, one thing I discussed in this episode with Hardeep is that I have been like the broodiest guy ever for the longest time. Like it was a dream come true when I became a father. So this was an episode I was really looking forward to recording. And I think dentistry does pose some unique challenges. And some of the challenges that Hardeep talks about, like, wow, her being 3 months into becoming a mother and having to go back to work to see a patient while her child who was breastfed was being given express milk upstairs by a nurse, because this is the reality of women in dentistry. And I've seen that in the practice where I work, where the dentist will come back from maternity leave to squeeze this private patient in for orthodontics. Like, you know, if you're in the middle of orthodontics and you need to go on maternity leave, that becomes a little bit messy. So we tackle these really real world themes. And as a parent, as a father in dentistry, with all the things I do, clinical and non-clinical, it's a real challenge. I do, and I know Hardeep tries not to bring her work home with her. I feel as though me, and probably you listening and watching to this, the Protrusive, you probably take your work home with you. You're doing clin checks, you're doing treatment plan letters, you're doing courses, online courses, webinars, etc. So it becomes really challenging to find that, I'm going to say work-life balance, but work-life quality, because that's the main change in thinking that we explore in this episode. So I really hope you gain so much from this journey that me and Hardeep explore, as well the unique challenges that parenthood poses to us as dentists. And so listen, and I'll catch you in the outro. Hardeep, Basi, welcome to the Protrusive Podcast. How are you?
I'm very well, thanks, Jazz. I'm excited. I'm excited to be here.
I'm super excited. In fact, you know, I don't know if you believe me or not, but I'm being deadly serious here. I have never been this pumped and excited, and I was telling my wife as well, for an episode of Protrusive before. Even though I do so much clinical, this specific non-clinical episode is very close to my heart. I'm going to talk all about that today. Parenthood is such a beautiful, beautiful topic. And I remember sharing an Instagram story not too long. It actually was in March, and that's just a testament to how a busy lady you are, Hardeep. You're so difficult to tie down. I'm so glad I finally got you on this Friday morning. I'm actually recording right now in my sister's old bedroom in my parents' place. You see a nice little crack in the loft ceiling here. You see all this red and pink decor. It's not me. It's not my usual place. So I'm making an exception for you to make this happen, because this is long overdue. Anyway, back to the story. I shared a story on Instagram saying, hey, I'm recording with Hardeep, and someone messaged whose name I now forget because it's so long ago, and he said, wow, Hardeep, I was in the hospital placement when she did Max something. Did you do Max?
Yes, I did. That's right.
And so he messaged, he said, she was one of the sweetest people I ever met. She was very popular with the nurses. She used to bring in food. I don't know, is that something you were famous for?
Oh, yeah. Well, I used to bring in like sort of leftover dinner from the night before. I used to bring, my mum's curries and things and not feel guilty about eating them in the staff room. No, but I did share with others. Yes. Yes.
Amazing. Well, you have this reputation, and he said that he was really looking forward to this episode. So sorry, buddy, it was in March, and I'm not going to go through my Instagram all the way to March. So thanks so much and for that. And so I'm really, really pumped for this. And just to give everyone a bit of context, Hardeep, I know because her dad is the person whose practice I did my first ever work experience at when I was like 15 or 16, and then your brother and I were very tight at school, and then I used to see him through dent school events as well. So Pritval, and I met Simran as well. So a real true family of dentistry. But for those who haven't got the complete picture here, just tell us a little about yourself, Hardeep, what you do at the moment. And I always want to extrapolate the journey, everyone's journey. How's your journey been? You're now in Scotland, you're a mother of one, tie it into your personal life, but just tell us a little bit about your professional journey.
Yeah, sure. First of all, thank you. Good morning to everyone. And Jazz, what a gracious introduction. And I'm so delighted and honored to be invited onto your incredible podcast platform. The fact that you were here today after arranging, I think, somewhat 3 times is a huge achievement in itself. And so it's all about getting the timing right. So I got past Parenthood to nursery, and I'm now able to fully focus on enjoying and having fun in this conversation with you. And yes, you're well connected to our family. I think for me, the journey has been, people would think that I've come from a family of dentists. It's been quite smooth and quite easy. And it's quite the contrary, Obviously, I came into dentistry before I came into parenthood. And coming into dentistry for me was a challenge in itself. And Jazz, of my dad. He's incredibly inspiring. He's a humble gentleman. He's a great educator, a mentor, and a support.
Very much is. Very truly is.
Yes, so many colleagues in the profession. And I'm very, very lucky to have had parents who encouraged me to go down any path that I wanted to. And they would always insist that being a girl, I should never limit my dreams. And I'm always eternally grateful for that. And growing up, my dad devoted a significant amount of time to building the family dental practice, which was incidentally just down the road from our home. And I really enjoyed going to the dentist as a young girl. And it wasn't far for a start. I would swivel around on the chair in the surgery or at reception, watching and listening and learning all the time. And, built rapport and relationships with all the staff and the patients alike. And, on the odd occasion, I would sit at the reception desk and cover it. And what really struck me, though, while I was there was that I was inspired by how many female dentists were working in the practice who had children as well. And taking all that into context with working alongside my dad and looking at what the dynamics of the practice were that he was building, an inclusive practice of males and females, I set my sights on following in his footsteps and studying to be a dentist. And the journey to becoming a dentist in itself was challenging. And during my school years, I suffered a lot with bullying and harassment, actually, and debilitating migraine attacks, which would incapacitate me for weeks. But this didn't stop me. I kept focused on my education, and I achieved the grades that I needed to get into dentistry. And I graduated in 2012 at the age of 24. And, being a young woman from humble beginnings in Hounslow to living independently that far from my family was really tough initially. But, I got my head down and I graduated with distinction in finals, and I had a few academic prizes at graduation. And the reason I share that with you is because I worked so diligently and I was so focused on my career aspirations as a young, independent woman that my desire to put that energy, effort, and time and hard work was almost ingrained in my DNA. And don't get me wrong, I pursued hobbies at university. I was socializing with my peers, and I was that girl who went out on a social night, and I would still make that 9 a.m. lecture the following day. But yeah, in my mind,
I can vouch for that from our meetings at BDSA.
Yeah. And at that stage in my life, I'd imagined this was my lifelong career, clinical dentistry. And, university was a great place. When I met you at the conferences and things, we made amazing friendships. And while I was at uni, I met Manrique, who was studying medicine at Edinburgh. And so, university time was really the opportunity where, I had a few part-time jobs. I was studying really hard, and I was playing hard as well. So that's when the juggling act sort of began. And then to explain a little bit more about my journey, when I left university and I entered the realm of clinical practice, I was still, energetic, ambitious, mature, although my siblings might might disagree there. But my focus was sort of channeled on attending courses, conferences, volunteering, networking, and just continuing to learn as much as I possibly could. And I'm glad I did that then, because looking back now as a mom, it's quite different to be able to seek those opportunities and have those networking opportunities and be out and about. And after completing my VT year training in Edinburgh, I returned to London, where I spent 2 years doing core training posts at King's College London and Queen Mary Sidcup, where I did oral surgery and max fax and general duties. And, I look back at that time in life and I'm always grateful for the inspiring consultants, the peers from whom I learned so much from in those early years. And during those years, I sat my MFDS exams. And I was maintaining a long-distance relationship with Manrique. But we made it work, and then we married in 2015, and I settled into married life, and I moved to Scotland. And, obviously a new town, no friends.
And that's why you've got this Scottish twang now. I can definitely hear it. I mean, we were saying earlier before we hit record, you sound very different to the Hardeep I once knew.
When I first started university, I was that girl from London with the posh English accent. And then now I'm like, so hybrid. There's a wee bit of a twang. Yeah, you're right, Jazz. There's a wee bit of an accent comes through. But yeah, it was difficult, because I was new town, no friends, finding a new job. And, but, I had incredible support from my in-laws, my family that I settled in with up here. And life was different, but it was so pleasant, Jazz. And I landed a job in general dental practice, which was fortunately, in comparison to my SHO jobs, the commute was only 15 minutes. And this was ideal, for me. And yeah, clinical practice was going really, really well. And I was building my self-esteem and confidence until one day I got a patient complaint. And I don't know about you, Jazz. Have you had a patient complaint?
I mean, I've had my fair share of near misses, but it hasn't been so bad. So are you happy to share just a little bit about how that affected you, what happened?
Yes, absolutely. I think it's really important to be open and sort of transparent about these, because there is a stigma attached about talking about things that don't go so well in clinical practice, and I'm more than happy to share that. The mental trauma of going through that tough time, it took a real negative emotional, mental, physical impact on me. And it was actually a turning point in my clinical career where it made me question whether I really wanted to continue with a clinical dentistry. And I know to some that might sound really irrational, but it was a thought that crossed my mind. And I don't think so. Hardeep, stop it. I don't think so at all. I don't think that's irrational at all. Like, even all the near misses I have, even like the restorative failures that I get that don't lead to any complaints, and the patient's very understanding, and I bring the patient in and fix it. Even just the other day, I was a little bit ambitious with the zirconia Resmar bridge, and I wasn't happy with the connector width, but I still fit it, and then the pontic snapped off, and so that still has the potential to give me a sleepless night. And then I still, despite how passionate I am, I still have those thoughts like, oh man, I hate these failures. Is this really what I want to do? So everyone gets those thoughts, especially when they experience failure, or I guess heightened even more so when you have something as stressful as a patient complaint. So I don't think it's irrational at all. I think it's very much normal to have those thoughts. Yeah, and just the sort of difficult part of it was that I didn't feel fully supported. Yes, we have our indemnity, but it was an experience that I know so many of us feel like we go through alone. And for me, fortunately, the complaint was resolved amicably, right? And it wasn't as significant. But the fear of that litigation, the fact that it was going to allow it to destroy my drive and my determination and passion because of one negative interaction over all the positive patient interactions I'd had up until that point. And so, it was really, really tough. And then to compound on top of that, I had a horrific car accident in June 2017. And without going into detail, I was so lucky that I survived because my car was written off. And, I suppose up until this point, the experiences I had made me reflect on life. That, up until this point, I've been so focused on a career that what did I want out of life? That I wanted to live fearlessly, and I wanted to live it fully in my potential, because you just never know how short it is. And, dentistry was my life, as a young married woman with that passion for the profession. But these life events that were happening to me made me question whether it was really for me. And I was overcome with anxiety. But you know what? There was a reason for this all happening to me, and life was happening for me at this point. It was a realization. It was a time where I knew there was a deeper purpose in me, and I had a desire that I wanted to start a family. And, my faith has always been a solid anchor, my self-belief. And I started reading around a lot of personal development, listening to podcasts, rebuilding my energy and my focus, and surrounding myself with supportive, positive people so that I could really unleash that potential in me. And, Jazz, things happen according to the divine timing. I really, truly believe that. And after my brother's epic wedding festivities in India, we went to Amritsar and we went to the Golden Temple. And there I prayed so deeply for a child. And 6 weeks later, I found out I was pregnant. And it was just the most incredible moment in my life. And the sheer joy of becoming a mother filled my heart with so much excitement. I thought, getting into dentistry.
Is that something that you always wanted to do? Were you always broody? Because I can tell you now, I don't know, is a man allowed to be broody? Is that the right term for a man? But I've always wanted to be a father. But for me, all those comments you said there about how it made you feel and stuff, when I saw those 2 lines on my wife's test, I've got a photo of me almost just so emotional and charged and happy and stuff, and it's been the best thing that's ever happened in my life. And I'm sure you're going to talk about that, but also talking about the challenges and how it affects our profession stuff. But yeah, I definitely share your sentiments.
Yeah, absolutely, Jazz. I grew up in a big family. I had surrounded by lots of cousins, and so having a family of my own one day was definitely an aspiration. But the timing of it, it's always something that culturally and socially conditioned, we're thought to believe that things need to happen at a certain age and, all that sort of stuff. But, for me, I was at the age of 30, and for me, it didn't matter about the age. It mattered just about the stage of life that I was at. And I was ready to take on this new challenge. And, I thought the journey of getting into dentistry and that career was challenging. I was in for a real treat when it takes 8 years to get into some sort of stability in a dental career, and it takes 9 months to become a mother, through that whole journey of pregnancy. But fast forwarding all of that, and when our baby boy arrived, it was just...
Hardeep, can I just stop you there one moment? Because I just want to just pick on 2 small aspects that we discussed. So in case you missed it when you were listening, guys, one little thing which, might have been missed in passing is that you said how you did so many courses early on, and then you did actually touch on the fact that actually now as a mother, you couldn't imagine doing that. And I feel the same, that I'm so glad I did so much of my education on the front end so that now I choose quality over quantity, whereas before it was quality and lots of quantity to see what's out there in the real world dentistry, to expose myself, and as a parent I definitely as now a learner, avid learner, as an educator now as well, finding the time. That's why I do a lot of my stuff online, because I can make more time for my son. So that's a thing just worth mentioning to anyone listening, that okay, if you're at a position where you're not thinking about children but you might like to have a family one day, then how is your career gonna map out? And then on a similar vein, my main question for you now is, before taking the plunge into motherhood, before family planning, did you, and I don't know if you've spoken to other mothers in dentistry, were you nervous about how this might affect your career progression? Because one of the themes I want to... It's actually the last question I was to ask you is, we see so many people at the top of our field who are male. We see so many lecturers. I look at conference programs, male. You see one female, and I feel as though a lot of the higher positions in dentistry are occupied unfavorably or too biased towards male. And I feel as though perhaps this has all got something to do with it. So how did you feel at the time about this would affect your career? Is that something that you thought about?
Yeah, I mean, absolutely, Jazz. I think this advice would have been really helpful while I was at university, to give people that advice at an earlier age. Things will happen when they happen for you and when you decide that you'd like to do things. But I think going on courses and pursuing your career aspirations, do that as early on as you can while it's all fresh in your knowledge and you're building on a good foundation from university. And I think coming out of university, I realized when I went into the real world of clinical dentistry, how much I didn't know. And so, yeah, I would absolutely advocate for doing things now and not procrastinating on those choices. And family planning is really important as well. I didn't have those sort of conversations with people earlier on. For me, it was a turning point in my life where I had to go through such adversity and such challenge to then decide, actually, I was so tunnel vision focused on dentistry that I lost sight of other things. And Hardeep wasn't actually planned in that way. As to, right, I'm at this stage in my career, now's the right time. It was other things that gave me that realization. And I think for me, it's quite interesting because I was having this conversation with Manrik the other day, and he said, I said, I think I've been on more courses before I had Hardeep. And he actually looked at me and said, no, I think it's the other way around. I think you've been on more courses since you had him. And I thought, well, maybe it's to get a break from both of you then. And, it's different. There's a lot of shifts that happen, Jazz, when you become a mother. And I can talk from that perspective. I had this wonderful life-changing experience of becoming a mum to Hardeep, who's now 3, even though I do introduce him as 3 going on 13. And it's the greatest thing, but it's also the hardest thing being a mum, because there's this shift in your identity. And, the amount of learning that happens when, a child is born, but so too is a mother, or in your case as well as a father. And so for me, the sort of key challenges that I had when I came into motherhood, and also, in keeping in line with my sort of career aspirations, was that when I returned back to work after 9 months, so I took 9 months of maternity leave, I was so anxious, Jazz. I was stressed. I had this fear of letting go, this separation anxiety. When I would drop him to nursery, we would be bawling our eyes out. That I've spent 9 months with him. He's been in my arms. He's been spending a lot of time with me. There is that sort of emotional connection that you have and that attachment. And then to sort of hand him over to somebody else who effectively is a stranger. You don't know the nursery staff. They're there to take care of your child, but you don't know them. They're not like a family member. They're not you. And I think for me, it was just all the emotions. I didn't know what I was feeling. I didn't know that this was normal. I became overwhelmed with the emotion of that sort of unhealthy attachment. So separation anxiety is a very real emotional feeling. And for me to kind of come through that, to grow through that, because, it was there for a long time. Hardeep cried for every single day for 18 months before he turned a corner and actually had a smile on his face going into nursery. And, for me, it was about managing, getting the help and support to help manage those feelings, that it was valid to feel that way. And it was an accepted part of being a mother or a parent and leaving your child in the hands of someone else while, you go to work. So, it's very normal to feel that. And I think it's really important to acknowledge it, to know that you're not alone in feeling it, and that you can get the help and support you need to manage that feeling. And so that's the beauty of it, is that you go through that to know that you become stronger. And then now, it's wonderful dropping him off to nursery, going off to work, grabbing a coffee from the drive-through on the way in, listening to a podcast, just enjoying that time without feeling guilty. And that's really what it means to me, Jazz.
Hardeep, you know what that reminds me of? I just thought it'd be apt to mention this. There's a book called, you're probably familiar with it, The 7 Habits of Highly Effective People by Stephen Covey. Very highly referenced. You probably read it, I imagine.
Yes, I have read it.
So one of the first chapters talk about what it is that you channel your focus to. So I know many dentists who are, very much focused on their careers. Everything in their life is about, my identity is a dentist. Now, if that gets taken away from them, then their life is over. And that's it. And then on the other end, you have people who are spouse-centered or children-centered. So everything in their life revolves around their children. And then, when they're 18 or whatever, and they flock the nest, and suddenly their life has no meaning anymore. And so what Stephen Covey argues is that we shouldn't be centered around any of those things. We should be values-centered. So I'm always having this discussion with my wife. I'm saying, Sim, look, I know we love Ishan. He's the world to us. But everything in our world shouldn't revolve around just him. He's a very important part of our life, but it should be revolve around our values. And he is very much part of that, but he is not the sole thing. And it's something that I think is worth mentioning, would you say?
Absolutely, Jazz. Couldn't agree more. And I think, the conversation about knowing what matters to you as a person, first and foremost, I think a lot of the time what happens is that, and coming into motherhood, before that, my responsibility was me and my career. And then he came along, and obviously you've got your relationship as well. And it's about your value system and quality of time in life. How do you choose as a family to spend time together, to make that time that devoted, no distraction time together, and also then be able to manage your work commitments and pursue your career aspirations? Because somebody like me has realized that they are, passionate about dentistry and specifically leadership in dentistry. And, you're absolutely right. It comes down to your why. Why are you doing these things? What are the barriers?
So essentially your children, our children, anyone listening who is a parent or wanting to become a parent, we love our children, but yes. I think the message here is, our children probably shouldn't become our why, because then you're attaching your entire center of everything to an individual person. And, if you had an argument with that person when they're a little bit older, and then that's it, your whole world's turned upside down. It should be very much centered around you and your values. That's essentially what the book says. Would you agree with that?
Yeah. Absolutely. Yes. You come first. And as selfish as that can sound to some people, it is absolutely necessary to set out why you're, absolutely, Jazz, what matters to you as a person? What do you value in your life? And of course, we value relationships, family, work. But, as part of all of that as well, are you giving yourself enough time to look after you wholeheartedly? Are you filling your cup with a lot of self-care? And self-care isn't, the sort of all around the sort of fluffy stuff. It's really unraveling your thoughts, your processes, it's messy, it's hard work. It's understanding the barriers that are keeping you stuck from unleashing your full potential. So absolutely, first and foremost, you need to tap into what it is that matters to you. What do you value in life?
Hardeep, I'm going to switch it up. I'm going to just talk about very specifically in our niche of dentistry. What do you think are the unique challenges that we have? Very much the meat of this episode. Like, fine, a lawyer could be discussing with another lawyer about the unique challenges that lawyers have with being parents. So what do you think are the unique challenges that dentists might have as a role as wearing the hat of a dentist, but also wearing the hat of a parent? Can you think of any? I've got one to share with you, but anything that you've experienced as a mother, especially.
Yeah, I think just for me, I've kind of alluded on it, but coming back from maternity leave, back into dentistry as a mum with a new sort of role and responsibility, for me it was the lack of support when I came back. And it was quite sad to just see that, you're just expected to throw yourself back into it with no sort of additional support. And, there were so many changes that happened because I was full-time before I had Hartaj, and then I came back and I was part-time. I had to obviously reconsider my working hours and my working patterns. There are so many challenges. I could spend an entire day talking about this. And I made a list of about 25 unique challenges to particularly mothers in dentistry and things that I've experienced. I remember... Oh my
goodness. Just go for it. Read them out. Just spend a little bit of time. Just go for it. Let's hear it.
Yeah. I remember, Jazz, I had a few ortho patients before I went on maternity leave, right? And I still remember he was only 3 months old, and I had to go back into practice. These were private patients. I had to go back into practice while I was breastfeeding, and sort of look after these patients, and that stress, luckily I had, a really nice supportive team at work. I remember one of the nurses holding, Hardeep upstairs in the staff room and giving him sort of express breast milk. And I'm downstairs in the clinic treating this, this patient. And, that in itself was a huge challenge. Like, how did I do that? Taking him with me to work.
Massive. Oh my goodness.
All that going on.
Hats off to you.
All of that going on. And I think it's just so overlooked. And, then you have the guilt, the feelings of guilt. Are you coming back to work too soon? Putting your child in nursery? What's too early? What's too late? You've got to think about your working hours, especially in the evening, if you've got no childcare, how late can you work? Your career progression, you've taken a break from clinical dentistry when you return, and you've got those feelings of being good enough at your clinical work. You've got, the imposter syndrome with both dentistry
Hardeep,
and...
I get those thoughts when I've been on like a 1 week off holiday and I come back and I feel like, oh my goodness, I'm so rusty in my decision making and my precision. I can only imagine after a maternity leave and whatnot. Absolutely.
It's crazy. And, a lot of people do sort of just dismiss it as, oh, when you go back, it'll just all come back to you. But it takes time, Jazz, and you need people around you. You need to be able to speak to people and share these concerns and struggles with them. You're coming back to work, you've got broken sleep, and I'm sure you experienced that too as a father. If you're sharing that sort of responsibility, looking after your child, you're coming back to work not fully alert. And, then you've got the sort of mad rush in the mornings, dropping the children to nursery or school or what have you. And have you had breakfast? Have you eaten something? Have you fulfilled your basic needs? And then you've got the element of, if your child is sick, and you've got to leave work, what's the contingency? What are the measures for?
Oh my goodness, yes.
For that consideration.
So Hardeep, I just want to talk about that. So my wife works in community. I'm in private practice. So she's salaried. I'm not. And therefore, if Ishan's sick, then it's got to be her. And it's always unfair. It's always unfair on her and the trust that it has to be her, because I'm the one who's private, and why does it work like that? It just makes sense, right? The person who's salaried takes a day off. It's just the way it works out. But lots of women in private practice, the whole maternity pay situation is something we may touch on, and that's very complex. But B, if your child is sick, there's no replacement for mum. Mum is mum. That's why I think motherhood poses such unique challenges. Challenge in a good way. That it's such a beautiful challenge that you embrace. But mum is mum, and mother is the most difficult hat to wear as a dentist, and that just highlights some of the issues. Like, what if your child is sick? Yeah,
you're absolutely right. They have this strong desire. When I'm sick, when I'm ill, I want mum. That's who I want to be around, and it's that phase of that sort of attachment that happens, and you can't just, working a busy NHS practice with all those sort of considerations, rebooking patients and things like that. It's tough going to get your head around. And, when you finish your 9 to 5 job, you've then got your 5 to 9 job, your dinner, the dishes, the bedtime routines and all of that. So it's really hard going. And I think that can't be overlooked or underestimated by, there needs to be more support for mums returning back to work. And I feel like that is one of the biggest challenges, that sort of holding somebody's hand and saying, look, I'm here with you. I hear you. How can I help you? And that is something that I'm so passionate about, which is one of the reasons why I started, which was back then the Dental Motherhood and is now the Lead Her. And we'll talk about that in a little bit. But I was just going to bring that into it, actually, because I've seen so much of your stuff on Instagram and how passionate you are about this. So just tell us, because you are essentially fulfilling the role that you wish you had in those stages where you felt maybe isolated, that you felt you need support. You want to be that support to amplify the voice of females in dentistry, which is a beautiful thing to aim for. And also, motherhood being part of that as well. So tell us a little bit more about Lead Her. What a beautiful name. Yeah, thank you, Jazz. Originally it was the Dental Motherhood, and the reason for that starting under that umbrella term was because on the back of, as you say, my struggles, my anxiety, returning to work, first-time mum, and also passionate about dentistry and my career aspirations in that field. So I set the group up to really provide an online community, a space. So I created that space, which was never there, and to bring together a community where we can have connection, we can have collaboration, and we can really share quite transparently and quite honestly and anonymously, if you wish, your struggles, and provide that support network, which I think is so important. Just to know that you have a platform to share and to get support is so pivotal. And I think, once I did the dental motherhood and it started to gain some traction, I then decided, why am I restricting this to just dentistry? There'll be, and this also came on the back of my clinical leadership fellow post that I did, that, I was with medical professionals and mothers and pharmacy fellows who were mothers. And, I decided, let me broaden this out. Let me expand it so that more women can come in. And, it's not just for mums, it's for any female out there in any field. It's about empowering, supporting, sharing knowledge and information, because I've been through those tough times. And if I can be there to support in any measure or capacity, then I will do that. And it's growing. It's a growing community. And it's lovely. It's a wonderful feeling. And we have so many exciting things going on in that group. Slow and steady, because obviously I'm trying to find that, time to be able to do it. But yeah, it's brilliant. It's really, really amazing.
How do we connect? How do we connect with that? What's the first step? Like, you've inspired someone listening today, and she would like to come on and connect with you and learn more about how to empower herself as a female in dentistry or beyond, because this podcast has got more reach now. How is the best way for them to connect?
So it's through Facebook. So it's a Facebook group called Lead Her. So it's lead.her. And you can join the Facebook group, and there are the community is growing. There are ideas that I'm coming up with as time goes on. We're going to be starting a book club, which is very exciting. And that will be a great way to learn and to get to know each other. And then I have organized retreats, which are luxury retreats for women to come away from their sort of comfort zone, experience new surroundings with new people, and, epic experiences and activities. And on those retreats, there is learning. There are leadership masterclasses where I impart some of the knowledge and wisdom that I have, and tools and strategies and techniques that have really helped me to grow into being confident, feeling empowered, and feeling happier in life, in being a dentist and a mum. So, it's a great community, and I would love as many to come in and join, because I think there's real value.
And I love your social media, Hardeep. It's such a positive voice in dentistry, and you're such a wonderful leader in what you're doing at the moment. And I wish you all the best success with this. So ladies, if you're listening in particular, if Lead Her is resonating with you, and I think it should with every female listening to this, you should definitely reach out, check out what all the ideas that Hardeep has, and it's only going to grow you as a person. So thanks so much for sharing that. I just wanted to bring you on to highlight and put a spotlight on Lead Her, which I can't get over how awesome the name is. I can't believe you own that. That's amazing. Tell us about, Hardeep, your work-life balance as it is now in the stage of life. Hartaj is 3. My son also, Ishan's going to be 3 next week. So tell us about your struggles, your goals with work-life balance. Is it elusive? Does it exist?
Oh, I love this. I love this topic, and I could spend a good few days talking about this. And I do share quite powerful information about this on the Lead Her retreats. And you know what, Jazz? The word balance, right? Recently, I had some conversations with some colleagues about this, and friends in dentistry who coincidentally are mothers, but also that aren't. And we debated the word balance, because balance is sort of defined as a stable mental, emotional, and psychological state. And what we were thinking was, a better word, a better term to use is quality over balance, because balance implies that everything is in a controlled state and certain state and an equilibrium. But the reality is we live in uncertain times and adversity, and things are changing all the time. So the idea of achieving balance almost seems quite unrealistic. So what we feel is that, and what I feel particularly as well, is looking at the quality of personal and professional life, knowing that that quality will vary from day to day. It'll be different in your health and your sickness and under different circumstances. But as long as you're giving your best, and that will be different day to day, the quality can improve. And as long as you're focused on being better and being kind to yourself along the way, for me, that's what it stands for. And I'll share my perspectives, and these are just my personal thoughts. They'll be different to, my parents and friends alike. But your quality of life, work life, is different for each and every one of us. And for me, it comes down to, again, what we already touched on, is my why and my values. Why do I do things the way I do? What do I enjoy doing? What lights me up? What is my purpose here? And, becoming a first-time mum, it was a tough ride. I had no one give me a manual, give me some advice or anything like that. My mum did impart some great wisdom with me. And having raised four children herself, I saw how she did it. But it is a roller coaster of emotions. And, with me having experienced burnout, overwhelm, anxiety, guilt, imposter, I can relate to how many of my female colleagues, and especially working mums, feel, because I've been there. But I've come out the other end with now a solid toolkit that I can tap into whenever I need. And we need our quality of personal and professional life to be a daily practice. Like, that self-care has to be discipline, daily practice at home and at work. And I'll focus, for the benefit of this podcast, I want to focus on the positive reflections, because I've grown massively just in this last year. There's been a huge amount of self-awareness and unraveling and unpacking all the messy thoughts and things that are going on, and gaining a deeper understanding of my values, my needs, my aspirations to live happily in both my career and at home. And for me, it needs to be achievable, and it needs to be about taking the time to reflect on how you want to lead in your life, taking control of the choices that you can make. And for me, it's about optimizing your mental and physical health and well-being every single day, both at work and at home. And it does come down to how you use your time, to really focus on how you spend it, because it's the most valuable asset we have. It keeps going, and it's the currency we have to get what we want out of our one life, our one conscious life. So for me, a good quality work-life balance is about being happy. It's about being healthy. It's about leading life on your terms. And, even when things get tough, they do get tough, but you have tools to help you thrive, not just survive. And so for me, it's about prioritizing. It's about my primary focus to have that sort of good quality life is personal health. And there's no substitute for health. Positive, healthy habits that you can do at work. And I don't know if you read the book Atomic Habits by James Clear, but your habits, your healthy
habits. I'm on
audiobooks
halfway through at the moment.
Yes, it's a fantastic book, right? And he talks quite about it being that these habits that we have in our personal life and our professional life need to be obvious, they need to be attractive, they need to be easy, and they need to be satisfying. And so for me, I prioritize things like sleep. It's a necessity. Worry thrives on a tired mind. So I do some meditations before bed. I do some light, gentle exercises. And, we try and take away all the electronic devices at least an hour before bed. For me, also, a good quality of life in both
sleep hygiene.
Sleep hygiene, exactly. And doing that sort of daily physical exercise as well. Making time at home and at work to do some daily physical exercise. So I have a personal health coach who educates me on good dietary habits, taking supplements. I have vitamin D sitting on my desk, discussing nutritional needs. And he has actually given me a bespoke, tailored
You'll need a lot of that in Scotland.
Plan. Yeah. Where, he's given me a really, really, a bespoke fitness plan where 5 to 10 minute bursts of physical activity, such as squats and lunges between patients is enough. We don't, as working mums, I don't have an hour that I can spend in the gym, but I have 5-10 minutes between patients that I can do some squats and lunges, or 5 to 10 minutes at home between, while the kettle's boiling or whatever I'm doing, to do that regular sort of physical exercise. And, I think he's also, at lunchtime, I always go for a walk, whatever the weather. It's so refreshing to get away from those four walls. And you know, I can't emphasize that enough. And I'm trying to get people at work now to come and join me on these walks, because quite often the default is let's go into the staff room and, you know, chat about cases or patients or, you know, whatnot. But actually getting outside in fresh air is great for that quality of life. And also, you know, Jazz, having time for your relationships. You know, you can get so consumed with work or home, and you kind of lose track of your relationship. So Manrika and I schedule some time to go for a breakfast date or a dinner date, and we'll do that while Hartaj is in nursery on a Tuesday morning. And so having that sort of communication and enjoying
very
those
often
reasons
overlooked, even in couples who are friends of ours who don't have children, and you know, that, for example, a couple of friends of mine who are both doctors, no children, and they just tell me how difficult it is to see each other. Like, they're both busy GPs, and they have very active lives in terms of sports and stuff, and then to make time for each other is difficult, and it becomes even more difficult as a parent. So you have to do life design. You have to design your life to actually put that in the diary as a recurring event, which, as lame as it sounds, like, it's so sad that in the 2022 we have to diarize time with your other half, but you do in a way. Otherwise, you just leave it to chance, and then other things take up priority. To have that dedicated space where you're going to give yourself to someone else for that time and the undivided attention, and to nurture that relationship is so important.
Absolutely. And you know what? They also, you know, for example, Hartaj gets to spend quality time with his grandparents, you know, for an afternoon a week, and sometimes more. So it's great while you need to consolidate and build on those relationships that you have. Otherwise, challenges do come in between that. And in terms of work commitments, you know, I keep my clinical commitments. I work 3 days. I was 3 days. I've now dropped to 2 at the moment. And while I'm currently on this leadership fellow, which is half my working week, and, you know, my full clinic days coincide with the days that Hartaj is full-time in nursery. So you have to sort of work it around your personal circumstances. And, you know, Manrik's working 4 days a week, and then he has a Tuesday off with Hartaj. So he's got his day with him and his commitment with him in the afternoon. So there's lots of things that come into play. And obviously for me, out of my working hours, I dedicate time for leadership coaching, developing Lead Her, organizing retreats. I'm constantly reading books on self-improvement and leadership. And, you know, all of it is learning. I make mistakes along the way. And sometimes I feel like, I haven't spent enough time with, you know, Hartaj, or I haven't spent enough time with Manrik, even though we did have a breakfast date, whatever it was, you know, or I've missed out on family dinners, you know, things like that. It does happen. But it's all learning at the end of the day. And it all comes down to your boundaries, you know, at work and at home. You know, I try not to bring work home. I consciously decide at work, there is no such thing as procrastination. If I do my notes, and I don't try to have any sort of remote access at home to do any clinical notes. I don't do it. I don't do it. I do what I can. If I have to add another 5-10 minutes onto the day, I'll do it. Of course, sometimes realistically, some things do need to come home, like I'm doing some Invisalign planning, case planning at home, or, you know, whatever it is. But I also learned to say no to things. You know, what am I saying yes to all the time that I should be saying no to? And realizing that I can't do everything and I can't please everybody, that I've got a level of autonomy and I need to make decisions. You know, it might be at home deciding, no, I'm not going to do the ironing today because, you know, I want to play with Hartaj for a couple of hours. Or no, I'm not going to cook tonight. We're going to get a takeaway because, you know, I want to, you know, spend time doing some work. You know, it's whatever really suits you, but it's that ability to create those boundaries. And if you don't, it can be quite destructive to your day-to-day living. And I think, you know, it's about being organized and having some structure, but also, you know, being quite spontaneous and picking out time to just, you know, have fun and go on a little adventure outside and just, you know, switch off. And not everything needs to be so regimental and routined, you know, apart from obviously when I'm organizing to go on courses and conferences, that also requires some, you know, structure. But it's really important, Jazz, I think, to get a good quality of life, both in a personal and professional sense, you need to have support. And I think we're very grateful that we have family close by and friends that we ask for help. And there's no, you know, I'm so, so grateful for that. And there is no as cliche as it sounds, you do become the average of the people that you spend the most amount of time around. So it's really about deciding what kind of life you want, carefully selecting the people who will help you live that life, right? Both in your personal and professional circles, and learning from each other. And I think also for me, what's really important is that I spend time with positive people, because energy is really important to me, and their personality characteristics rub off on me. You start to grow together. Mm-hmm. And with Hardeep, as a mum, that quality time that I focus with him, I remove distractions, I silence notifications, I sit with him, and I ask him what you'd like to do. And I think just giving that dedicated time to build that attention, connection, and love, be present, and is more powerful than anything. We sing songs together, we read, we draw, we color, we snuggle up and watch a movie, we'll go outside and kick the football around, swim, whatever it is. But as they say,
I'm very much the same. It's all about undivided. It's about quality. Your quantity is great, and we can have it when you have a week off and you spend extra time together. But when that, when he's gone to nursery, I've come to work, come home, it's about everything has to go. It's all about Ishan for that 1 hour, and to really fulfill my role as a father, and I get so much enjoyment and fulfillment and energy from that. But it's about, at that point, if I'm not replying on Instagram and whatnot, it's because I'm busy. I'm with Ishan, and there is a place for that. If I'm constantly multitasking and I'm giving some of my time to Ishan and some of my time to Instagram or whatever, it's just not going to work. So I definitely agree with that.
Absolutely. And I think also, well, you mentioned, disconnecting from social media, because it can be, really overwhelming, all these sort of messages and replies and things that you got. And people do generally post, and I am guilty of this. I post a lot of positive, good stuff, right? And I do also share struggles and, mistakes along the way, because it's an important platform for learning. But I think it's so important to be able to decide I'm going to switch off. And also, if it's not playing with him or doing things with him, I like to have time for me. I like to be alone, and have some time out to really ground myself, go and do things that fulfill me, whatever that might be. Whether it's booking a massage or going away on a retreat with some other incredible women, I think we really, really need to give ourselves that to have a good quality of life, which I think between personal life, home life and work life, you are in control of that quality. And, I try to live in the moment, in the present.
That's been a huge learning point from this podcast for me, Hardeep, is I'm removing the word balance now. It's no longer work-life balance. It's work-life quality. I really, as a lasting sentiment, that is such a wonderful thing that you shared. And definitely, I agree so much with that. And yeah, balance, I agree. There's no such thing as balance. It's impossible to achieve, I think. I think you're always one or the other, and then things just balance out. But it's all about quality, focus on quality. So that is something that's resonated very much with me.
And Jazz, also, I think we just really need to, a lot of us worry about tomorrow, 5 years, and worrying about tomorrow really robs you of the joy of today. So it's about being present. It's okay to plan for the future, but to live there, live in the present moment, enjoy the precious time that we have now, make it of value. And I think that is so, so important to really understand that. And I think, you really can have it as a female leader in our profession if you want it, if that's what you desire. And, if you choose to believe, I think dentistry is a great profession for women with families and without. Do plates fall as I'm performing my judging act? Of course they do, but the show must go on. And I keep showing up, I keep learning, and I keep being inspired. And then it's my duty as well to share it and support others along the way. Each one teach one. And, when you make it to that point, when you're there at that point in your journey, it's your duty to look back and help the person behind you. And I firmly believe that. And yeah, so we need to focus on ourselves.
Well, I definitely think you've helped a lot of people who listened and watched today. I've gained so much. I think this episode is an essential, listen or watch for anyone in dentistry, whether you have a family or not, but especially if you are female. I think the things you covered with Lead Her and things you're doing, I want this to reach every single female dentist. I want everyone who's thinking about children in the future, family planning, to listen to this episode. I think we've covered so much ground, and I've had a really lovely time. And I knew there was a reason I was looking forward to this, and you have absolutely lived up and exceeded that expectation. Hardeep, thank you so much for making time for this. It finally made it happen. And I'm going to get everyone I'm going to put the link to your Facebook group or just instructions how to find it, down below on the show notes, so everyone can find that. And yeah, I mean, I really appreciate you making time for this.
Thank you so much, Jazz. It has been an absolute privilege and an honor. And while I'm on this platform, I'd like to share a little bit about the retreat that's coming up, if anyone is interested in coming and joining us. So the Lead Her retreat is in September, on the date of the 23rd to the 25th of September. So it's a Friday to a Sunday. And it's really there for you to have quality time and space out for you, away from your family, in a stunning luxury resort in Scotland. And it's a really unique opportunity to enjoy epic experiences and connect with other amazing, amazing, wonderful women. And it will allow you to relax and recharge and learn really, really powerful leadership skills that you can employ into your personal and professional life. And if you're interested, get in touch with me through the Lead Her Facebook group, or alternatively, Jazz can share some contact information about me. I'd be happy for you to reach out by email or text. So yeah, it's an experience.
I'm really upset, Hardeep.
You want to come, Jazz?
I'm really upset. I just checked the dates, and we're away in Turkey that week, because I really wanted Sim to go. I really wanted the Sim to, because you know what, she works so hard, and I love everything you're doing, and I want her to be part of what you're doing. And recently she won't talk about it on her social media, but she finished her first year's Masters in Peds at Eastman. She got a distinction, and she's done really well. And I want her to mix with the positive-minded females like you, because sometimes she lacks that self-confidence. And I think, Sim, you're capable of doing wonderful things, and you are the injection of positivity she needs. And so September she can't make it, but the next retreat I'm all over. Well, I'm going to make sure I pack her and I send her a poster first class to you to change her life.
Oh, amazing, Jazz. Oh, listen, there'll be plenty of these opportunities. But yes, I would love, love, love to spend time with Sim. She's a fantastic woman. And absolutely, it's about inspiring, empowering each other and lifting each other up, because there is greatness within each and every one of us. And we just need to recognize our potential and be around that support network that drives you to be the best you can. So thank you so, so much for giving me access to your incredible platform. And Jazz, you inspire me every single day. So thank you.
The feeling is very much mutual, Hardeep. Thanks so much. And I'm indebted to your family, your father, your brother, all these people in my life growing up, in my journey of dentistry. You are important parts of it. And so thanks to Kunus. And just want to say, Vaji Khalsa, Vaji Khateh. Thank you so much, Hardeep, for coming on once again.
My pleasure. Thank you, Jazz.
Well, there we have it, guys. Thank you so much for listening all the way to the end. Do reach out to Hardeep on her platforms. In the show notes on protrusive.co.uk, I'll put all the links, the brochure for her retreat, and how to connect with Hardeep. If you enjoyed this episode, would you consider leaving a review on your platform, wherever you're listening, whether it's Spotify, Apple, on YouTube? Comment below if that's the case. A review would go a long way in making me see who's listening, who's watching out there. As always, I really appreciate you being a true fan and listening all the way to the end. Thank you so much.